Hello, and thank you so much for joining us for the video series titled Teaching and Learning Evidence-Based Relationships, Interviews with the Experts. This project is brought to you by the Society for the Advancement of Psychotherapy, APA Division 29, and is a companion project to the third edition of Psychotherapy Relationships That Work. The overall goal of the project is to translate relationship research to teaching and learning, from the classroom context to clinical supervision. My name is Dr. Raina Markin, and today we are very fortunate to be joined by Dr. Georgiana Shick, Tryon, who is a professor emerita at the Graduate Center of the City University of New York in the PhD program in educational psychology. Her research interests and publications focus on the psychotherapy process and ethical issues. And today's topic is to discuss how to translate research on goal consensus to teaching and training. Thank you so much for joining us today.
You're welcome. Glad to be here.
So could you start off by just telling us how you operationalize goal consensus in your work, how you conceptualize it with patients?
Well, actually, the meta-analysis that Sarah Birch and Jay Verkuylen and I did not only looks at goal consensus, but it looks at collaboration between client and therapist. Goal consensus we define as the agreement between client and therapist about the goals of therapy, the commitments to those goals, and the agreement on the tasks that will get the therapy goals achieved. Collaboration is the mutual involvement of client and therapist in the helping relationship.
And can you briefly summarize what you found in the recent meta-analysis?
Well, we found that both goal consensus and collaboration related positively to psychotherapy outcome. These were medium effects, which means that they could be observed by anybody looking in on the therapy. And this meant that clients and therapists who work together collaboratively and achieve goal consensus tend to have better outcomes.
So one thing I'm wondering about is if in the meta-analysis or if in your work you've looked at goal consent when the patient and the therapist have goal consensus, but they don't necessarily have collaboration. If there's still those positive outcomes, or if it's an additive effect.
Well, they're positively related, but they're not totally related. So I assume that it's possible to have goal consensus without a lot of collaboration. However, goal consensus is usually arrived at through collaboration. You have to be on the same page in order to say, here's where we want to go and here's how we want to get there.
Yeah, certainly. I think sometimes with students, and maybe we'll get to this sort of in the next question, I think what I find is sometimes the client is eager to agree with the goals when the student therapist states their opinion about what the goals should be.
Yes, and sometimes the student therapist states the opinion too early because he or she wants to impress the client that they'll be able to be of help.
So I guess along those lines, based on your findings, how do you approach training graduate students to, attend not only to goal consensus, but also to do it in a collaborative way and to really train them to be competent in doing that?
Well, it all starts with having good helping skills, good interview skills, active listening skills. And so when a client comes in, they don't usually come in with prepackaged goals.
Yeah.
A lot of times they come in with complaints about I'm anxious or I'm upset. And what you need to do as a therapist is listen to the client's story. The clients need to tell you what's wrong. And sometimes they're not always clear on that. So using good helping skills is important. And this means asking clients questions that are what we call open questions, questions that don't call for a yes or no answer, but allow the clients to elaborate, reflecting the client's feelings and summarizing what the client says, asking for clarification. You really need to get the client's story so that you can determine why they came. And then after that, you can determine what they would like to change. And in order to do that, you have to be very involved with what they're trying to tell you and listen very carefully.
Yeah, I think that's a good example of how skills or techniques can, interact with the relationship, that you need to have good skills, good helping skills, active listening, using open questions to facilitate these relational components of goal consensus and collaboration.
Yes, and it takes patience to exercise this. We all want to get in there and show our stuff, but it's important to be patient and listen to the client's story.
Right, right. And I think one thing I find is, I think the client usually comes in and their sort of goal is to feel better.
Yes.
They're suffering and their goal is to feel better. And one thing I struggle with students is how to help them sort of reframe that goal with the client in a way that is sort of consistent with the theoretical orientation, their way of practicing in a collaborative manner, to take it from, I want my suffering to be reduced more globally to something more specific and tangible.
Yes, and that's part of the goals is the task of how to get there.
Yeah.
As well. These are the things that we can do together to help you to be happier, or whatever. Actually, happiness is not a good goal. But the clients have to be on board with what you can do. For instance, if you are behaviorally oriented and the client really wants to gain insight, this is not necessarily going to be the best match.
Yeah. And I think one thing I find in my own work with clients is that when we negotiate the goal consensus, that it's most therapeutic when it's done in a way that helps the client to feel empathized with, that I really get what they need.
Yes, and that's understanding their story.
Yeah.
And if you summarize that to them and say, can you add things? Can you clarify things? And then you summarize again until you get it exactly spot on, you have the best chance of achieving a good goal consensus with that client.
So do you have ways, or suggestions for instructors in the classroom for how they can most effectively train students to sort of, get the story, listen to the narrative, sort of train them in the process of goal consensus?
Well, I think it helps if you have practice interviews, and if you have your own therapy, if you're a student, you can indicate, you can find out firsthand whether you feel understood or not, and whether your goals are the goals for your therapist. I suggest you pick a good therapist if you're going to do this. And then just doing it and having good supervision and listening to feedback for other students helps as well.
Do you have sort of readings or specific videos or websites that you like to introduce to students, either in supervision or in the classroom context, to help train them in this?
Yes, I do. For therapy skills, I highly recommend Clara Hill's book on helping skills. This is in the 3rd edition. It's called Helping Skills, Facilitating Exploration in Insight and Action. And it's published by APA. The current date of the book is 2014. And she also has a video that's part of APA's Systems of Psychotherapy videos, where she outlines this, and you also get to see her doing an interview. So that's good helping skills. this book is, I can't tout it highly enough. In terms of goal consensus, I just have a chapter in a book that just came out in 2018 by Oxford University Press by Mick Cooper and Duncan Law. They were the editors. It's called Working with Goals in Psychotherapy and Counseling. And it has chapters from people who have been in therapy, which actual clients and experts on setting goal consensus. And like I say, I have a chapter in there as well. Then next year, probably spring of 2019, Jairo Fuertes is editing a volume called Working Alliance Skills for Mental Health Professionals.
That's great.
I have a chapter in that called Setting Goals and Tasks in the Working Alliance, and it's just a total clinical chapter that walks you through how you attain goal consensus in a collaborative fashion.
That's great. Those are great resources. I use the Clara Hill video and text too, and it really helps the students to see it.
Yes.
Yeah. And one thing that I was thinking of is that, the importance of teaching students that goal consensus is not a one-time process. I don't know if you find this, if you have found this in your training of students, but I think sometimes students think if we set the goal in the beginning, that's what the goal is, and we don't need to revisit it, which sometimes might be true, but I think more practically, it's evolves sometimes, the goals.
Yeah, most times the goal evolves. Therapy is an ongoing dynamic process, and goals come, goals go. Sometimes goals aren't achieved. A lot of times goals aren't achieved. The idea is that it's an interactive process. It's a collaborative process. And I think this is where some of the research fails us, because goal consensus and collaboration are often measured at just one time.
Yeah.
And in fact, it's an ongoing operation.
Yeah. No, I think that's very important. So what are some of the most common challenges that you come across when training students in goal consensus and collaboration?
Well, I think they generally come under the term of students' anxiety about being able to perform well as a therapist. We really want to help people, and students want to get right in there and show their prowess. And they'll be able to do that if they just sit patiently and wait for the stories to unfold. However, a lot of students get anxious, and I was certainly one of them. I used to come up with great formulations that were truly profound very early on, and I would get criticized for it by my supervisor, who would say, "Georgiana, just hush up, wait, and you will find out what the student wants or what the client wants to tell you." So I think that that's one of the biggest things. And then there are also students that get very anxious about the particular kind of problem. When you see your first client who talks about suicide, that's oftentimes a very challenging time to be a student trainee.
Yeah.
Or somebody who has eating disorders and comes in and announces that they want to lose more weight.
And I think that sort of performance anxiety has come up as a common challenge across this video series to facilitating, different relational components. So I'm wondering, what advice you have for instructors and supervisors about, how to help students with that performance anxiety.
Well, the main thing is just to relax, concentrate on the fact that you've been educated and that you have skills, and rely on those skills. Don't think so much about being evaluated, which is very difficult to do when you're a graduate student.
Yeah.
And know that we all learned this and we all started this way and we all screwed up,
Yeah.
and you will get through this and you will do a better job than you currently are doing.
Yeah, yeah, yeah. And I think, again, that's so important, and it's been coming up again and again in these video series, it's just sort of helping students be okay with making mistakes.
Yeah, because everybody does.
Yeah.
And the client doesn't expect you not to make mistakes. The client expects you in the end to be able to exercise your skills and help.
Yeah, yeah, yeah. Good advice. And Georgiana, are there measures or credibility checks that you use either in the classroom context to help train students to identify, goal consensus, or that you encourage student trainees to bring into the sessions with clients?
Well, I certainly am a big fan of the Working Alliance inventory, particularly the short form. It's only 15 items. It has a goal scale and it has a task scale. And you can actually give that after every session. But I also rely heavily on having people ask the client,
Yeah.
how are you experiencing working together? What kinds of additions and corrections do you have to this operation? I think it's important to share with clients that it's a mutual thing. You bring the skills, but they bring the problems, and they know the problems way better than you do because they've been living with them.
Yep.
And for collaboration, the CalPass is also a very good instrument that can be given fairly frequently.
Great, great. So I guess, what do you think are some of the most important lessons for psychotherapy trainers, or even for students, to take from this moving forward?
Well, I think for trainers, they should definitely emphasize that it's a collaborative, interactive situation. Just training people in an empirically supported treatment is not enough. There actually has to be this relationship where there's a mutual engagement in the operation. So that's important. And for students, they need to know, like I say, that they have the skills, the client brings the problem, and together, if they work together mutually, they're probably going to achieve some kind of good outcome.
Yeah, yeah. And really, just like you said, the importance of the process of collaborating and negotiating these goals is in itself therapeutic.
Yes,
Yeah.
the process of collaboration and goal consensus sets the stage for any other operation that you're going to do.
Yes. I like to tell my students stories about my kids. I have an 8-year-old and an almost 4-year-old, and they're experts at negotiating goals. They never just accept a goal of mine. So I've gotten a lot of practice negotiating goals, but that's part of their separation individuation, and I like to tell students about that. It's about what's important. It's not only the end goal, it's the process of how you negotiate when you want different things in a relationship.
Yes, yes, it's the process. And I'm sure that your 4-year-old is very good at telling you the goal,
Yes.
but maybe not yet knowing the process.
she's learning, but she knows how to work the system. But yeah, she's learning. Yeah. So what do you think are the next steps for the research, but also for psychotherapy trainers and supervisors? Like, where do we have to go moving forward from here?
Well, for the research, definitely there should be, as I say, a more thorough look at the entirety of sessions rather than just measuring it measuring goal consensus at a static period. And I've given a lot of thought to that as a researcher, for trainers, like I say, the process is so important. Without the process, you're not going to be able to affect these wonderful treatment packages
Right,
that are empirically supported.
right, right, right. Well, thank you very much for taking the time to talk with us, to share your knowledge and share your experience. I think this will be a lot of help for psychotherapy trainers, students, supervisors, so we really appreciate it.
Well, I hope so, and thank you for interviewing me.